Welcome back to the Sports Medicine Orthopod. My name is Anthony Yu. The winner of the Interesting Injury Award this week goes to Baker Mayfield. And so I brought on my good friend, Dr. Drew Burleson, sports medicine specialist and Cleveland Browns fan, surprisingly, to come on and talk about his team, his quarterback, and try to make sense of this injury. So, Drew, it's Friday, the day after an exciting, week 7 Thursday night football win. How are you feeling?
I'm feeling good. I mean, I was nervous going into the game. Case Keenum leading us last night. He played pretty well. Big win. I wasn't expecting to stay up for the whole game last night, but it was just too close to go to bed. So I ended up staying up watching the whole thing, but I'm feeling good today.
Like a true fan. And so we're going to talk about today, is this the beginning of the Case Keenum era, at least for this season? And at this point, it remains unknown. And so let's go through some history. Baker Mayfield hurt his non-throwing left shoulder in week 2, and at that point was diagnosed with what was called a partial labrum tear. And so quick anatomy lesson, the labrum is a structure deep in the shoulder. The shoulder joint kind of looks like a golf ball sitting on a tee, but turned up 90 degrees. So golf ball sitting on a tee, turned up 90 degrees. And on that flat part of the joint, the T, there's this ring-like structure that lines the periphery. We call that the labrum. And we actually break up the labrum so we can speak about it in a way that everybody understands into a clock face. So 12 o'clock, 6, 3 up in front, 9 in the back. And as you could imagine, if that structure is torn and the head's moving around on it, if it's maybe torn in front, every time the head of the humerus, the ball butts up against that torn labrum, that's going to cause pain. And it could even so much as cause the shoulder to be unstable. And that's a word you're going to hear us talk about a lot today, instability of the shoulder, where that labrum structure, that bumper that kind of secures the head in place, is compromised to the point that will actually allow the ball to slip out of the socket, what we call dislocation, or partially come out of the socket, maybe not all the way, what we call a subluxation. And then a new wrinkle into this story is, well, I should back up. Then in week 6, he got hit again, fell onto the left shoulder, and that's what triggered this whole, is he going to have surgery? How much time is he going to miss? We're not sure. And at that point, he came out with comments this week saying his labrum was completely torn. He was ruled out for Thursday's game. Possible he returns in week 8, but unsure. And then yesterday, this was Thursday at about 5 p.m., an ESPN article says, reported with comments that he made, that he actually had a fracture, a break in that bone as well. And as a result of that, he was having trouble firing his rotator cuff tendon. So we're going to break that down for you guys and what that means to us as orthopedic surgeons, shoulder specialists when we hear that. Drew, what were you thinking when you kind of watched this all and read about it playing out?
So in the game in week 6, he had that typical mechanism where he fell, he was hit to the ground, had the arm out like in this position, and the arm back that way. And I was initially optimistic because he went to the blue tent, was able to come back into the game. He actually even tried to practice on Tuesday. I think he may have practiced on Tuesday, actually. And then on Wednesday, he just couldn't go anymore. Again, the fact that this is his non-throwing shoulder, I still think there's a chance that, he's able to rehab and play the rest of the season. Again, especially the fact that he was able to practice on Tuesday. But again, I think it still, we have to wait and see, how he responds over the course of the next, week or so in regards to what he does long-term for the rest of the season.
Yeah, and this is an important fact. It's his non-throwing shoulder. Do you think if this was his right throwing shoulder, there's any way he's considering coming back to the field this season?
No, I don't think so, because like we talked about before, the position where you get in, wherever it's the position of instability, is with your arm out in this position and externally rotated like this. So again, if you try to think about it, every time you try to throw a ball, you're getting it into this position. So that would leave him, that'd probably be very painful for him, because he'd be testing that front part of his labrum every time he brought his arm back to throw. The fact that this is his non-throwing shoulder, I think, makes it a lot more likely that he's able to try to rehab and go back and play the rest of the season.
Yeah, and you bring up an important point, which is that labrum tears can present in a number of ways. It's usually pain, or it can be instability, as we talked about, or it could be both. Now, we have not examined Baker Mayfield. We don't know his imaging. We don't know what happened on the sidelines. And so we're not actually sure if his shoulder was dislocating. I did read a report today that indicated that he was. And some of the comments he made this week about sort of the goals of rehab, one of them is to stabilize the shoulder, maybe would lead one to believe that he has an unstable shoulder. But regardless, we know he was in a ton of pain, labrum tears, when, again, that shoulder is struck or put into a certain position that challenges the labrum tear. Very, very painful. And it speaks to his toughness that he was even, able to continue to compete or was even thinking about coming back to play this week. For the average human, that's not going to happen. This is me or you, and, we're, young, strong guys who have to work with our hands. We're orthopedic surgeons or labor. You dislocate your shoulder or you re-aggravate a labrum tear, you're not thinking about going back to work a few days later. You need to rest. But the fact is, like, he actually toughed out a game and the rest of that game and thought about coming back this week. And so, tough guy, right?
Absolutely. I mean, it's one of those things that during the game, you have that adrenaline going. And so, I mean, it's you're able to fight through a little bit of that stuff. But I think, after the game, I think he realized, how much more pain he was in. And again, like, whenever you can't practice, I mean, I think that he realized this is a lot more serious than they thought initially. So, again, I think that's what that kept him out last night.
Yeah, I think before the decision that he was going to be ruled out for Thursday Night Football was made, he did seek a second opinion, probably from somebody similar to us, a sports medicine doctor, maybe a shoulder elbow specialist, who, probably advised him, this is not in your best interest to play this week, and we'll see. Now, let's talk about this thing of the tuberosity fracture. And so I brought out this little model, this being the front of the shoulder, this being the back. The tuberosity are these little knobby pieces of bone on the outside of this thing, which we call the proximal end or the top of the humerus, humeral head, whatnot. And they're attachment points for some rotator cuff tendons. So you're looking directly at the side of it. One of the biceps tendons is coming down here, down the front. That's that thin strip. And then this is a very commonly injured rotator cuff tendon called the supraspinatus that attaches to something called the greater tuberosity, which actually two other rotator cuff tendons here in the back. Let me see if I can do this. Yeah, they attach there as well. And then there's a smaller tuberosity in front here that attaches to a fourth rotator cuff tendon called the subscapularis. And so, I think you and I were surprised to kind of read about this tuberosity fracture, a little wrinkle to the story. What were you thinking when you heard that?
So there are a couple of things. I mean, like, whenever he was driven down to the ground, it could have just been a fracture that from being driven down to the ground. The other thing is sometimes when you actually completely dislocate the shoulder, the front part of the shoulder can hit the back. It can basically, if you can imagine like this, the ball can go out the front, and when it comes back, the ball can hit the portion of the socket. It's actually called a Hill-Sachs lesion, but I mean, that's can be described as somewhat of a fracture as well. I think that's probably more along the lines of what it is. It's probably a Hill-Sachs lesion that he has. So again, but the rotator cuff muscles do attach onto there. But if I had to guess, then that's more than likely what it is. Just the fact that if the shoulder came out of place and that ball was able to hit that socket, then he had a subtle injury to the head portion.
Yeah, and these Hill-Sachs lesions are typically indentations. It's not like the piece of bone popped off and is floating in space. That can happen with tuberosity fractures. And certainly when that occurs, the rotator cuff's not going to work because it's now attached to a piece of bone that's floating in space and not attached to the rest of the humerus. That's probably not what's going on here. Like, if that was the case, he's getting surgery. Those tuberosity fractures, unless they're really not that far off, those need surgery. And so obviously no surgery has been committed to yet, so that's probably not what's going on. But that sort of indentation, impaction, fracture, or break certainly could be. Explain to us why the rotator, they mentioned specifically, his rotator cuff is not firing. Like, why might that not be? The rotator cuff is still attached, presumably, to this traumatized piece of bone, but why wouldn't it actually kind of work right now?
I mean, so whenever you have, one of your body's reflexes to pain is just to shut down. You see this a lot with people who have like knee problems or things. They just say that they feel like their knee is giving out on them. Whenever they're ligamentously stable, but it's just like the pain is causing their knee to buckle, and they're like, oh, my knee keeps giving out. I think I have a ligament injury. That's usually not what the case is. And I think that's probably the case with this as well. that, I mean, it's just his body. There's nothing that he can do about this. It's just his normal body's reflexes that whenever he tries to fire his rotator cuff muscles, that the cuff is actually pulling on that torn piece of bone, and he's just not able to do that. So I think it's going to be a little bit of time before that fracture, the Hill-Sachs lesions, to heal a little bit before he's able to fire those rotator cuff muscles without pain.
Yeah, absolutely. And again, if we're going to analogize this to the general population, that's probably going to take several weeks to heal up to the point where you feel like you've got your rotator cuff back under your own voluntary control to move that left shoulder in the way you want it to. And so let's talk the rest of the season before we jump into, what's been alluded to, that he will likely need surgery in the off season for this left shoulder. What are you thinking? Is it likely he comes back next week, or, and we should just say for the general population who's general audience who's listening to this, there are no exact timelines on this. This is just, kind of what we see in our own practices, but there's definitely a range.
So, I mean, the question, I think the first question would be, when's he going to come back? And I think it'd be difficult to say. I would be optimistic that he's back next week, just from the standpoint that he practiced on Tuesday. He went back into the game after the initial injury. He practiced on Tuesday, and then it was Wednesday when he decided he couldn't play. They're going to have a long week, so he has whatever from now until the next Sunday. So over a week before he's able to get back, he's going to have a lot of treatment on this shoulder. And again, the fact that this is his non-throwing shoulder, I think it's a lot more likely that he's able to come back next week. I think he makes it back at some point in time this season. Timeline-wise, I don't really know.
Yeah, I think that's accurate. And again, like you alluded to, it's just going to depend on how comfortable that shoulder feels. Again, I mentioned that it's been indicated he's going to go for surgery, most likely on the shoulder at the end of the season, which what we find interesting is that, the calculus of decision making for a professional athlete is different than, say, somebody like you or me. If we have this injury and at this point we're thinking it's a recurrent injury because he first did it in week 2 and now he's done it again, we're probably thinking surgery at this point for us pretty soon, right? We're not going to wait another 6 months to do that. But for a professional athlete whose livelihood is dependent on him being on the field, it's different, right?
Absolutely. The one thing he does have going for him is that he's 26 years old. So the younger you are, the first time you have a shoulder dislocation, the higher risk you have of having recurrent dislocation. So young being like less than 20 years old. So when you get to be in your mid-20s, I mean, there's absolutely the possibility that he can rehab his shoulder, and without even having surgery, he could have a completely stable shoulder and never have any issues with this ever again. I think, again, if there is, I don't know if they'd be dead set on the fact that he's for sure going to have surgery in the offseason. My take would be he's probably going to try to come back and play the rest of the season. If he gets back and he's absolutely fine, has no other dislocations, no instability events, feels 100%, I think there is the chance you just try to rehab this and never have surgery ever. I think the other things that point towards surgery would be, again, if he continues to have episodes with this, he feels like his shoulder is kind of sliding in and out of place. Also, the fact that he plays such a high contact sport where he's going to be getting driven into the ground many times in the future. He's at a lot higher risk of having recurrent instability events. So, I don't think it'd be completely unreasonable to think that he is able to rehab this and never have surgery. But I think the goal would be to get him through at least the rest of the season and reevaluate at the end of the season.
Yeah, and what you said there about the football is a huge point. He's at a very high risk, plays a very high risk sport. Rugby would be another one. And so the chance of re-injury, especially at the quarterback position, I mean, it wasn't like he meant to hurt his left shoulder again. It just happens. He's going to get hit. He's going to be driven to the ground. You can't always protect a particular body part you're trying to in those types of situations. And so very high risk for re-injuring this again. But to your point, do you have to have surgery for a shoulder that's got a labrum tear and maybe dislocated 1 or 2 times? No, not necessarily. I mean, I think in our practices, the folks who are doing shoulder stabilization surgery for are typically those who dislocate the shoulder over and over again. It can get to be so bad that, they're dislocating in their sleep, or something very innocuous like reaching back to grab a backpack in the back seat or something, and then the shoulder pop out. There is some talk to be more aggressive, maybe even after the first or second dislocation, to be more aggressive with surgery. But yeah, there's certainly a role for trying to treat this non-operatively. I think our fear for Baker Mayfield is just that he plays a very high-risk sport, and the chance of re-injury is really high.
Yeah, absolutely. I mean, again, if he's already had 2 injuries, again, the first one being whatever the partial labral tear, then having another one, again, given the sport that he plays, I mean, I think that they probably lean towards it like as soon as the season's over. Because again, like the last thing you want to do is try and treat this non-operatively, and you get into week 1, and all of a sudden you dislocate your shoulder again next year. Then you're like, well, shoot, we should have done this when we had the chance.
Yeah, absolutely. And there's recent precedent for this, although not in the NFL. I'm sure there is an NFL player that has gone through this exact same thing, but I can't come to mind. But the one I'm thinking about is in the MLB, Cody Bellinger, who we famously did a podcast about before we came to YouTube, about he hurt his shoulder, which I think it was the NLCS. Dodgers made it to the World Series. He had dislocated, I think this was the second time in that playoff injury, and was able to rehab it enough so that he participated and played pretty well in the World Series, got a title, and then immediately in the offseason had stabilization surgery, which went very well, and was back that next season. And, out here now still doing it without further repercussions. And so let's talk about the surgery momentarily. So in the grand scheme of things, surgery for the labrum, whether it's a labrum tear that's causing pain or instability or both, it's pretty successful. We do a lot of shoulder surgeries for different reasons, rotator cuff tears, biceps issues, etc. But I'd say labrum, it's up there towards the top in terms of what we can expect for a very successful outcome. Would you agree?
Oh, absolutely. Yeah, I mean, I think this is a great surgery. I mean, honestly, like some of the happiest people you have. I mean, they usually do very well. You fix the problem. It's not like they just have pain. It's like their shoulder is popping in and out of place, and all of a sudden you put it back into place. So, I mean, yeah, overall, very successful surgery.
Yeah, and the other thing that's important for Baker Mayfield or high-level athletes or athletes of any kind is not only can we solve the pain or instability, but can we also get you back to playing at the same level you were before? And, granted, this is a non-throwing shoulder, so it's not like we're going to be, clocking how far he throws with his left arm. But generally speaking, it's pretty high percentage that go back to playing at the same level they were before. So that's all great news. How do you fix it? Like, how do you actually go out and fix a labrum tear?
So, I mean, what you do is, I mean, again, imagine that the shoulder is a golf ball and a golf tee, okay? And on that golf tee, like you said, is the labrum. The labrum kind of acts as a bumper. So imagine like whenever you're going bowling, they have those bumpers that go up on the side. So imagine like in the spot, like, again, if we were looking at a clock face, if this is, 12 noon up here, it's just 3 o'clock on this side, and then, again, 6 o'clock right here. Usually those labral tears occur right in this area, okay? Right in the front part between 3 and 6 o'clock. And that labral tissue, again, imagine it's like a bumper, just falls down. So you free up that tissue that's kind of scarred down there, and we put something called suture anchors. So what a suture anchor is if you've ever put a heavy picture up on a wall, you usually have put an anchor into the drywall so the screw has a better purchase in there. We use these in surgeries a lot too. So those anchors go into the bone, right onto the face of the socket, and then we take the suture that goes around that tissue, pull it back up, and tie it right back into place. If you're curious enough, you could go to my Instagram page, Drew Burleson, MD. I mean, I think the last video I posted was fixing a labral tear.
Yeah, it's an awesome video. It's very slick, and I remember when I saw it, I'm just like, what is this? But actually, it was great, and it's a very similar technique I use. And you'll see in that video, it looks like Drew is underwater because he's doing what we call an arthroscopic surgery. He's in a minimally invasive way with a camera. The joint is distended or filled up with fluid to give a nice clear picture and kind of separate the joint structures so you can get in there to maneuver not only your camera, but the small instruments to fix these tissues. And that's a very common way to fix a labrum tear. There's a traditional open technique where you're making more of a big incision down the front of the shoulder, open it up. One of the really nice things about the arthroscopic approach, as you could guess, it's a little safer in terms of risk profile compared to a bigger open surgery where you may encounter nerves and important blood vessels. But also, sometimes those labrum tears, they'll escape out the back as well. They'll kind of come up that 6 o'clock region, up towards 9, up the back. And it's really hard to approach a labrum tear in the back coming through the front of the shoulder. And so when you're in there with the camera coming from these different angles at the shoulder, you can really get access to that circular structure, that labrum from every angle to fix, any type of labrum tear. So it's a really nice way to do it for a number of reasons. And then Drew, what's your typical expected recovery time after labrum repair or stabilization surgery?
So I would say usually probably around 4 months, 3 to 4 months to be completely 100%. Usually you're feeling pretty good 2 to 4 weeks after surgery. I mean, people usually get their motion back pretty quickly. We protect certain things though. So you're not really running much until about 12 weeks after surgery. That's kind of what takes the longest time, is really to let everything heal up, but then get back into shape, because you don't want a lot of jostling on your repair. So again, you're not even really running or doing much activity until about 3 months after surgery. And then at that point, you usually let them start doing a little bit more sports specific stuff. So again, to get your conditioning and to get back to full active participation, you're probably looking around 4 months, maybe a little bit longer.
Yeah, it takes the labrum about 3 months to heal solidly. And that, as strong as Baker Mayfield is compared to you and me, that's just human physiology. But the rehab is much faster than, say, a rotator cuff repair, which really is more like a 6-month recovery, and maybe in some cases even longer. Let's just touch base on this new piece of information we have, and that is the tuberosity fracture. Would you expect that needs any surgery, or
No.
would you just let this heal and then so be it?
I think it's probably insignificant. Again, it could be a Hill-Sachs lesion that we talked about. He just could have had he could have a small non-displaced greater tuberosity fracture, but it sounds like, based on what they're saying, this is a relatively insignificant finding on the MRI.
Yeah, so non-displaced fracture basically means the pieces in the puzzle are all the same, or are in the same location, but there may be a little crack through the foundation, and that will heal up, especially in a young guy like this, no problem. Again, we talked about if the tuberosity had popped off completely, separated from the humerus, that needs surgery, so we know it's not that scenario. Otherwise, he would have had it fixed. And there are some Hill-Sachs lesions, these gouges into the bone that are so deep that you do have to do something for that. You actually fill in the gouge with some overlying rotator cuff tissue, but that's not that common, and probably wouldn't be needed in this case. So yeah, I agree. Most likely it's something that causes pain right now, but should heal very reliably and not affect his ability to come back this season, or even after his potential surgery in the off season.
Right. Absolutely.
Well, I think that about wraps it up. Drew, you must be feeling pretty good. I talked to you before the game yesterday, and there was trepidation in your voice. Now you're feeling...
I had very high hopes earlier on in the season. A lot of injuries. We got one of our tackles back last night. We looked overall pretty good, but no, I'm feeling really good right now.
Good.
Baker back. I'd like to get the rest of our running backs back as well. But to win last night, we're very happy about that.
Yeah, and we got NBA season here. Are you excited about that?
Man, you got to be, man. Steph had a night last night. My goodness.
Steph's still doing it. You just keep thinking, man, how long can he keep this up? And he just keeps doing it. But
I know my wife texted this morning. She's like, wasn't he like a little pipsqueak from Davidson? Like, how is he doing so well? And I'm like, I honestly, I don't know. I really don't know. He's unreal.
He's got some guns now.
Yeah.
Pipsqueak got some guns. All right, Drew, really great seeing you. Everybody, thanks for tuning in. Please hit the subscribe button so we can keep doing this for you. And we'll catch you next time. Thanks very much.
Hey, folks, thanks for tuning in. If you like the show, please subscribe, like, and share. And we love to hear from you. If you have a question about today's show, or you, a loved one, or maybe your favorite athlete has sustained a sports medicine injury that you would like to know more about, please reach out to us on Twitter, Instagram, Facebook, or email. And stay tuned for more exciting content from the Sports Medicine Orthopod. Thanks again.